a few things have happened to change policymakers' thinking about Alzheimer's. Partly worth keeping in mind, they're just people, they're citizens, and so their thinking has evolved with the rest of us. And so more and more people, and including policymakers, understand that Alzheimer's is just not normal aging. I think Reagan helped that. Reagan helped to trigger that when he shared this poignant letter with the country on a Saturday afternoon. It was in every paper across the world the next Sunday morning. I had been going to our public policy forum for several years after that. When you went into a legislative office, you didn't have to explain to people what Alzheimer's was. They might say to you, yeah, that's what Reagan has, right? Yeah. So they knew at least what you were talking about. I think the other thing that's happened is that in the last 5-8 years, legislators have started to understand the cost of Alzheimer's disease. It is the most expensive medical condition in the United States. And I think even people who think, I've often thought that sometimes one of the problems in funding Alzheimer's is that sometimes there's a sort of unconscious, unspoken societal cost-benefit analysis that says, well, this portion of the population that has Alzheimer's disease, they're older, they're about done anyway. Should we be investing large dollars in that segment of the population? And now I think we're starting to see that, well, if you don't, it's costing us tremendous societal dollars. We estimate now that Alzheimer's disease costs Medicare and Medicaid, what we in California know as Medi-Cal, about $160 billion annually, and the estimate is by the middle of the century, by 2050, that cost will soar to over $1 trillion annually, just to those two publicly funded programs.
Right.